Hello everyone. I wish everyone a good awareness on today's World Anti-Diabetic Day. So it is 14th of November and today it's globally celebrated as World Anti-Diabetic Day. So what I can contribute in is that I can talk about some of the important pharmacological updates. So that is how I will be celebrating today's World Anti-Diabetic Day. So I will be giving you an overview of the latest updates, pharmacological innovations that are in the research, have been approved for the well-being of the patients who are suffering from different kinds of diabetes. So let's get started. Welcome all to his Pharmacology-Difficult podcast. I'm your host Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. So, let's get started. We all know that there are so many drugs including insulin, different types of insulin, and amongst the different kind of drugs apart from insulin, the choice of drug we all know is metformin. That is, if we say the drug of choice today or the best drug for diabetes apart from insulin is metformin. And in the insulin, the regular insulin and the short acting insulins, they are the best ones. In the long acting ones, we have different kinds of like glargine, etc. So, insulin are generally used as a kind of a mixed combination therapy, and apart from the insulin, there are so many classes of the drugs. I'll be talking about the latest pharmacological updates. So, if I say the best medicine, well, today's scenario, I would definitely go for metformin. Now, the next I want to talk about is the continuous glucose monitoring systems. Along with the continuous glucose monitoring systems, there are subcutaneous insulin infusion pumps. These are also the one kind of systems. One is the continuous glucose monitoring, that is capital CGN systems. Along with that, I want to talk about the subcutaneous insulin infusions. Now, they both have been looked upon as quite promising, which can exercise a very good control over the glycemic index in the blood circulation. But I would only say that every new or novel therapy has its own challenges. So these also have their own challenges. Still, we are waiting for the perfect evidences to support their use, judicious use, and to prove their efficacy properly. So these both the things, continuous glucose monitoring systems and subcutaneous infusion insulin pumps, they are in the research, not yet approved, but they are very, very promising novel techniques. So that's the first thing I wanted to talk about. Now, next I want to comment that along with these approaches, a very great significance is of self-disciplined lifestyle. That is one of the greatest needs in case of diabetes patients. If this is practiced along with the novel therapies, then this can significantly increase the quality of life. Also in stage 3 of type 1 diabetes. So that is how powerful is the disciplined lifestyle therapy is. It can really improve the quality of life even in the later stages of type 1 diabetes. Now, amongst the proven drugs, I would like to talk about sodium glucose cotransporter 2 inhibitors. That is capital SGLT2 inhibitors. What are these drugs? They are FDA approved drugs which can actually exercise a good control over the blood sugar in the adult patients. And especially in the patients suffering from type 2 diabetes. The basic medicines or the main medicines in this class or group of drugs, they are canagliflozin, dapagliflozin and empagliflozin. Amongst the known drugs, empagliflozin is considered as one of the most popular effective drugs, and the reason is that it is very selective drug. So that is why it is one of the preferred drugs. If we talk about the cost effectiveness, then dapagliflozin is one of the most cost effective and cheapest drug available. But if the patient is suffering from type 1 diabetes mellitus and ketosis prone type 2 diabetes mellitus, and if the GFR, that is the glomerular filtration rate, is very low, then sodium glucose cotransporter 2 inhibitors, that is SGLT2 inhibitors, should not be given in such patients. They should be restricted. If a patient is suffering from chronic kidney disease, then dapagliflozin is one of the best suited drugs known till now. But you should know that best selling and most popular drug is empagliflozin because of its selective nature. So that's a talk about SGLT2 inhibitors. Now let's go to the next talk. Now I want to talk about very new drug, Tzield. The spelling is Tzield, Tzield. And what is Tzield? Tzield is a kind of an antibody. It's an anti-CD3 directed antibody. Its mechanism is binding to a protein, that is antigen, which is found on the surface of the T lymphocytes, that is the white blood cells. And this antigen actually attacks the beta cells and slows down the immune system. So once it binds to the Tzield antibody, its mechanism is totally inhibited. What is the administration or dosage kind form of Tzield? It is given as an infusion once a fortnight, that is once every 14 days. Its name is Teplizumab-mzwv. And how does it help? It slows down the progression from stage 2 to stage 3 type 1 diabetes. We all know that type 1 diabetes is an autoimmune disorder where the own immune system is attacking the insulin making cells, that is the beta cells. So this drug Tzield, it protects the beta cells, and then the patients can survive at stage 2 type 1 diabetes for a longer duration of time. The progression of the disease is stopped. Isn't that a good news? It was approved by US FDA in November 2022. It can be used in both adult patients and pediatric patients, 8 years of age. Some kind of ADRs that are reported with the use of this antibody is cytokine release syndrome. It's a dangerous ADR. Then sometimes there is a decrease in count of the white blood cells, and there can be liver problems and decrease in the complete blood counts also. So these are some of the problems that are associated with the use or long-term use of this antibody. Next I want to talk about VX-880 stem cell therapy. It's also heard about. The origin is from the Melton lab, Vertex Pharmaceuticals. How does it help? It promises complete differentiated pancreatic islet cell replacement therapy in type 1 diabetes. And the announcement was made in American Diabetic Association 84th scientific session by the Vertex Pharmaceuticals. Next I want to talk about, in July 2023, US FDA approved drug Lantidra. What is Lantidra? It's the first allogenic, that is donor, pancreatic islet cell therapy from the decreased donor pancreatic cells. and this is given for the cure of type 1 diabetes. It is best suited for adult patients who cannot target the glycated hemoglobin, and the reason behind this are the frequent episodes of hypoglycemia. That is why they cannot target the glycated hemoglobin. That is how it works. It is given once dose in liver, and the infused cells, they release the insulin. Now next, we also aim for the beta cell regeneration and immunotherapy. Both these, beta cell regeneration and immunotherapy, are the promising cures in near future. Next, I want to talk about lastly Tirzepatide. Tirzepatide is the drug which is available as Mounjaro. It is FDA approved drug for type 2 diabetes mellitus. It is given once a week in the adult patients. How it is different from Metformin, let's get to know about it quickly. Metformin is oral and can be given in the pediatric patients also up to 10 years of age. Mounjaro, it provides better glycemic control in the blood, and more weight loss is also seen as compared to Metformin. But on the other hand, Metformin is more cost effective and affordable. So that is how it wins. Side effects, especially the gut related, stomach related side effects, they are the same in both the drugs. Mounjaro can also cause pancreatitis and gallbladder diseases, and we all know Metformin can lead to lactic acidosis. Mounjaro's mechanism is to act like GLP glucose dependent insulinotropic polypeptide, that is GIP analog. Both GLP-1 and GIP, they are the gut hormones. How does it work? It signals the pancreas and the insulin is released. After eating, the liver stops making the glucose. It affects the brain regions also, which regulate the appetite and the fullness after eating. On the other hand, Metformin is a biguanide. It lowers the glucose in liver, but it does not give any signal to the pancreas. It lowers the glucose absorption from the food that we eat. Sometimes both the drugs, Mounjaro and Metformin, can be taken in combination because they act differently. That is an advantage of these two drugs. Another advantage of Metformin, Metformin is available as pills in combination with other drugs like glyburide Metformin combination, sitagliptin Metformin combination, ampagliflozin Metformin combination. So these are some of the combinations Metformin is available as, but Mounjaro is available as itself. So if your weight loss along with diabetic treatment is the main objective, then one should go for Mounjaro. Else, Metformin is a choice of drug. Other novel innovations and drugs are amylin GLP-1 duo antigen. The drug is Cagrilinitide-Semaglutide combination, which is known as Cagri-Sema. Another one is a triple antigen of GIP, GLP-1 and glucagon. Triple antigen. The drug is Retatrutide. And the other one is oral GLP-1 agonist, that is Orforglipron. So these are some of the latest innovations and pharmacological updates that I wanted to tell you on this auspicious occasion of World Anti-Diabetic Day. Awareness and knowledge about the treatment cure is very, very important for everyone, and one should be very well disciplined as far as lifestyle is concerned. Then one can combat the disease and get over the complications very easily in support with the physicians. So both patient and physician duos efforts are required as far as the proper management of this disease is concerned. In the end, I would just like to say, for all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine, that is Pharmacology Further e-newsletter. It actually contains a lot of updates about medical sciences, drug information updates, and lot many other updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you're listening for the first time, do subscribe and follow whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcasts. Stay safe, stay happy, stay enlightened. Thank you.